The daily living activities of a human body, be it walking, sports, or recreation, require sound balance of musculoskeletal system. Of all the joints of our body, the knee joint is one of the most stressed and often abused parts of human skeleton. Regular physical activity produces a force of more than 5 times our body weight through this joint. Articular cartilage is a special kind of tissue known as hyaline cartilage. It assists in load distribution across the joint and aids in diffusing impact loads. Injury or trauma to the knee joint can lead to damage, resulting in cartilage tear. Unlike most tissues, cartilage does not have the ability to heal itself. If untreated, cartilage injuries more progressively deteriorate. This deterioration can continue until the bony joint surfaces rub directly against one another, causing severe and often chronic pain, leading to severe osteoarthritis. Chondron is autologous cartilage implantation therapy for cartilage defects. It enables effective regeneration of damaged joint cartilage and provides numerous advantages for the patient, like shorter surgery time, shorter rehabilitation time, and optimal long-term healing. Chondron is indicated for the use of osteochondritis dissecans, cartilage lesions and defects, osteochondral defects, and early osteoarthritis. Chondron process begins with medical assessment of the patient. As a preliminary step, a thorough diagnosis via MRI is done to inspect the joint and determine the extent of injury. Once the patient opts for the autologous cartilage implantation procedure, the patient is admitted to the hospital. Arthroscopic surgery is a minimally invasive surgical procedure in which a visual inspection, examination, and repair of joint is performed. The surgeon removes a small biopsy of articular cartilage from a non-weight-bearing area of the knee. Biopsy is then aseptically transferred into a sterile biopsy kit and is securely transported to RMS Regrow Cell Processing Center located at Lonavala at temperature-controlled conditions to enable a true autologous cell cultivation process. The patient is discharged within 24 hours after biopsy. From the moment the patient's biopsy arrives at the Regrow Cell Processing Center, it is subjected to proprietary methods and assays to test and verify both safety and quality. Every step performed at Regrow's GMP and GCP certified laboratory is in accordance with established high-quality standard procedures. In the laboratory, the cartilage-producing cells are released from the biopsy. The released cells are cultivated and introduced to a proprietary chondrocyte expansion process. Within 3 to 4 weeks, the appropriate number of cells are obtained. The cells are evaluated for their cartilage production capacity. The cultured cells are then securely transferred to the hospital for implantation. Once the implant kit reaches the hospital, the patient is admitted 1 day prior to the scheduled date of the implantation. Chondron implantation is performed via minimally invasive surgical procedure. First, the surgeon identifies the defect and removes the defective cartilage. The Chondron implant is then placed onto the defect site. Once the implant is set and the same has been confirmed, the surgeon closes the joint of the patient. Chondron implantation is now complete and will ultimately result in the formation of hyaline cartilage at the defect site. Rehabilitation is a crucial part of the recovery process. Post-operative mobility is encouraged in order to maximize the cartilage regeneration. Rehabilitation is performed under strict guidance of the physician and physical therapist. Chondron treatment is available to patients with cost benefits through medical insurance, both reimbursement and cashless procedures. For any further enquiries, you may feel free to contact on toll-free number 1800-209-0309 or email us on info@regrow.in or visit our website at www.regrow.in. Chondron is exclusively brought to patient use in India by Regenerative Medical Services Private Limited. Regrow your cells, rebuild your life.